when to use a supraglottic airway? There are different aspects where the supraglottic airway can be used. So it can be used as an immediate airway measure once you have tried intubation. So let's go with the sequence. The patient is unconscious and you have decided to secure his airway because he is not able to, there is increased risk of aspiration and he is not breathing well. Right now we give a jaw thrust and we'll ventilate with a ambu with 100% oxygen. So the oxygenation is maintained now. So next step, you try to secure a definitive airway, which is intubation. We'll get into that later, but just imagine we put a laryngoscope in the mouth, try to put the tube inside, but you are not able to visualize the vocal cords. There is a lot of edema, or there is difficulty in the position is not right, and you're not, for whatever reason, you're not able to visualize the vocal cords, and the intubation has been failed. So now, what I have said, the oxygenation is paramount. The moment you decide or realize that there is a failed intubation, you just get back to maintenance of oxygenation, because any attempt to establish intubation at the endotracheal tube inside or LMA during that time, it could be 30 seconds, 1 minute, 2 minutes, sometimes more than that, we are not providing any oxygen to the patient. So this is what you have to remember very much. So that's why you have to realize as soon as possible with any difficulty which you are facing while establishing a definitive airway. So while you're establishing a definitive airway, if there is a failure in it, you are not able to put the tube in, or you are not able to visualize the vocal cords properly, you just step back, remove the tube, and get back to bag mask ventilation. So then now you realize the ventilation, so endotracheal tube insertion is difficult. Now you pick up a supraglottic airway device. This doesn't require any laryngoscopy. It is direct insertion. So you directly insert it in the oral cavity. The mask of the laryngeal mask airway or the supraglottic airway directly sits on the larynx. You connect your ambu or your ventilator circuit and it starts ventilation. So now the first indication, as we discussed, when there is a failed intubation, you use a supraglottic airway to bridge for the next step. Second thing, if there is inadequate bag mask ventilation, when there will be inadequate bag mask ventilation, as we have discussed prior, if there is an obese patient, or you don't have a proper sized mask, or you are not able to, you don't have a second help, but the jaw is heavy, you need 2 hands to establish a proper seal well ventilation, or everything is there, but for whatever reason, the bag mask ventilation is becoming inadequate. So then what do? You pick up a supraglottic airway device, put it across the oral cavity. This will establish a secure airway and a pathway to provide ventilation to the patient. So any time where the intubation is failed, supraglottic airway comes to rescue. So it is a bridge to the definitive airway.